Hello. I'm so sorry I'm not able to be with you today. I'm sure that Yakima is beautiful in the springtime. So before I actually get started, I want to say thank you so much for your patience, and please bear with me. This is COVID-19 real reality and doing things very, very differently. I want to thank Dwayne at the very beginning for the editing that you had to do. I know you're going to make me look great, so thank you. So why don't we go ahead and get started. I look forward to providing a little bit of background about our Arcora Foundation and our work in Yakima and across the state to prevent oral disease, expand access to care, and integrate oral health into overall health. We are committed to raising awareness that oral health is essential to overall health and oral disease is preventable. First, I'd like to acknowledge the influence of Yakima on our work. Currently, we have 3 board members who proudly call Yakima their home. Carmen Mendez is the chair of our Policy and Communications Committee. Diane Patterson is our incoming board chair. And Dr. Kurt Laberton, in addition to being on our chorus board, is also on the Delta Dental Board. It's important to note that like our Arcora Foundation, Delta Dental of Washington is also a nonprofit. They fund our work and they share our vision to improve overall health for all, with no one left behind. Together, we're focusing on improving the health in communities across the state. And today, more than ever, the community's health is so very important. Unfortunately, Yakima has been especially hard hit by COVID-19. I've experienced working in clinics, hospitals, and public health, and have a lot of friends on the front line. And we're really fortunate that they are working so hard to keep us all safe. Like you, I deeply appreciate their dedication and are committed to supporting their efforts. This pandemic is having a tremendous financial impact on businesses, both large and small. For example, Governor Inslee mandated the closure of dental offices for elective procedures to help prevent the spread of COVID-19 and also to preserve personal protective equipment for healthcare workers. To help dental practices that are closed, Delta Dental has committed $13 million in grants and advanced care payments. Tremendous job losses also means that the lines at food banks are growing longer. Both Arcora and Delta Dental have contributed over $350,000 to help with food security across the state, including a donation to the Yakima Community Foundation. Another very important effort that everyone should know about is our free referral service to DentistLink. As you'll see here on the slide, this includes our telephone number to reach DentistLink, as well as the webpage, dentistlink.org. Even though most dental offices are closed, dental emergencies haven't gone away. In response, we've expanded our DentistLink referral service to connect people with urgent dental care. Our aim is to keep people away from the emergency room as hospitals face unprecedented strain on resources and staffing. Anyone who's unable to connect with their dental provider can contact a referral specialist by phone to search for a dentist provider in the community who's open for urgent care. In addition to the recent COVID-19 grants, our Arcora Foundation has been involved in Yakima for many years in many different ways. Since 1990, we provided nearly $2 million in funding for organizations in Yakima, including dollars for scholarships, dental clinics, and improving seniors' oral health. As Carmen mentioned, I am new to Arcora and to Washington, having arrived in early February. And in addition to enjoying the delicious fruit, the fabulous wine, and the other bounties of the valley, I am also proud to have built wonderful working relationships with 2 of your local leaders, Anita Moynihan from Yakima Neighborhood Health Clinic and Carlos Oliveras from Yakima Valley Farm Workers Clinic. I'd like to spend a few minutes now talking about the value of oral health and why public health is so vital. In my previous role, I had patient members of the board, and one in particular stands out. Her name was Wendy. She was a self-appointed dental advocate, and Wendy had had a very challenging life. Wendy had lost all of her teeth by the time that she was 30, and she had years trying to find affordable oral health care. She finally was able to do that, got her dentures, and it was just like she blossomed. She was able to be more self-confident. She smiled all the time. And Wendy actually was able to get gainful employment after she was able to get oral health that she needed. And after that time, Wendy's become a real advocate and zealot for everybody getting the oral health care that they need. And she's even trying to spread that to her 6-year-old grandson, teaching him good oral health habits today. The pain of dental disease can interfere with many things with daily living: your sleep, eating healthy foods, learning, and your self-esteem. Infections in the mouth and inflammation can spread to other parts of your body. Oral disease is linked to diabetes complications, heart disease, problems during pregnancy, and other serious illnesses. The bottom line is oral health affects overall health. You are not healthy without a healthy mouth. That's why one of our key initiatives is to make sure that oral health is integrated with overall health. And we're making important progress. Nearly 50% of physicians who treat young children have been trained to pay attention to oral health during well-child checkups. And some are even starting to do some procedures like applying varnishes to children's teeth to protect them from cavities. Why is this so important? Preventing disease early can improve oral health for a lifetime and save money for families, for businesses, and for taxpayers. It also saves pain and anguish for individuals who are dealing with very painful oral health issues. This is a good example of the benefit of public policies that improve community health. One of the leaders of this effort comes right from Yakima, Dr. Russ Meyer. He was a foundation board member for 9 years and a strong champion of this work and other efforts in Yakima to improve oral health. I'm really fortunate I was able to meet him in person before we are all sheltering in place. Thank you, Dr. Meyer, for all of the work that you've been doing. In addition to providing excellent leaders for our organization, Yakima has also been a leader in oral health. Let me provide a few examples. Washington's nationally acclaimed Access to Baby Child Dentistry program, ABCD, has been providing dental care to young children from low-income families and celebrated its 20th anniversary last year. ABCD helped improve the health and lives of hundreds of thousands of kids across the state, including many in the Yakima Valley. Our foundation has provided more than $6 million in grants to spread this program across the state, and we manage the ABCD program statewide. In this slide, you'll see what changes have happened in the ABCD program across the state and in Yakima. In Washington, the percent of eligible children receiving dental care annually has grown from 20% to 54%. ABCD in Yakima County is truly a success story, with 66.2% of the children in Yakima who are eligible getting this service. You're leading the state and you're leading the nation in the percent of low-income children from birth to age six who are receiving dental care. This is really an incredible accomplishment. The number of children in Yakima County receiving care has nearly tripled since 1999. Community water fluoridation is another big success in Yakima. Voters approved fluoridation in 1999. An entire generation has stronger teeth and better oral health because of this community decision. Fluoridated water prevents cavities for everyone, young and old. This is a perfect example of how a public health measure benefits the entire community. The concept of public health is at the very core of the social distancing steps most of us are taking. I focused on public health in my own formal studies and have a master's in public health, so I'm a true advocate for it. And it's really important to me, and I advocate for it because it focuses on low-cost strategies that prevent disease and protects the entire community's health. These functions have always been important, but they're especially so today. Our healthcare system historically has focused on treating diseases after they've occurred, rather than preventing it before it starts. Much of the trillions of dollars spent on healthcare each year goes toward developing new expensive tests, costly pharmaceuticals, or different procedures. However, vulnerable populations often do not have insurance, or their insurance may cover some of the more, may not cover some of the more expensive treatments and medications. Too often, your health status is determined largely by where you live and your income. As a result, There are huge disparities in our country and unfortunately in our state too. We can do better. Our new COVID-19 reality puts into sharper focus the value of prevention in communities and health for all of us. It makes sense to ensure more funding is available to prevent diseases before they start. Prevention improves health and lowers healthcare costs for everyone. For example, only about 22% of low-income adults in our state have access to dental care. Dental problems often start out small, but can quickly become more difficult and expensive to treat. If everyone has access to dental care, and if more people receive the benefit of community water fluoridation, many dental problems would be prevented, saving money, improving health, and people would feel better. Good oral health care requires a combination of both personal and community responsibility. Each of us can practice healthy habits at home. This is especially important right now, since most dental offices are closed. I'm remembering a dental director that once said that one of her patients had asked, well, do I really have to brush and floss every day? She's like, no, absolutely not. Only brush and floss the teeth you like to keep. Well, that answered the question for me, so it really stuck with me. Here are a couple of videos we developed for our Mighty Mouth campaign. Mighty Mouth delivers messages to motivate target audiences and healthy behaviors to prevent oral disease.
Mom. Mom. I'm thirsty.
Instead of sugary drinks, choose tap water to prevent cavities and maintain your beautiful smile.
Honey, who is that? Wow.
Water with fluoride is best because it strengthens teeth. Too much sugar leads to cavities, obesity, and more.
Thank you.
Hey!
Did you know that healthy snacking leads to healthier teeth? Help your child learn to choose tooth-healthy snacks like fresh fruits and vegetables, nuts and cheese. Choose water for thirst, not sugary beverages. Juice, soda, and sports drinks have lots of sugar. Sugar causes cavities, and cavities in baby teeth can lead to cavities in adult teeth. Remember, your child is healthier with a healthy mouth. Visit themightymouth.org to learn more.
We also have a community responsibility to make sure everyone has access to the keys that lead to good oral health. This includes access to fluoridated water, basic dental care and education, and essential resources, including nutritious food that people need for a healthy mouth and a healthier body. As we are witnessing, it makes sense to ensure that essential workers, including those who work in grocery stores, and they work in the fields, and they deliver our packages, all have good health. And good health includes oral health. We know how to prevent oral disease, but we need time and the will to make it happen. Perhaps one lasting legacy of this pandemic will be a new appreciation for the importance of healthy communities. I hope we'll see a new commitment to prevent disease and protect everyone's health, with no one left behind. We all benefit when everyone in the community is healthy, and we truly are in this together. In closing, I want to thank you for the opportunity to share my thoughts and leave you with a timely quote from the former U.S. Surgeon General, C. Everett Koop. Healthcare is vital to all of us some of the time, but public health is vital to all of us all of the time. Thank you for your patience, and thank you for the opportunity, and I look forward to meeting some of you in person.